Hi, welcome to the Doctor Digest. ANT के प्रीवियस ईयर क्वेश्चंस करते हैं ऑफ नीट पीजी. सो क्वेश्चन नंबर 1, एक 18 साल का लड़का इमरजेंसी डिपार्टमेंट आता है और उसके नाक से खून बह रहा है. आपने जब चेक करा तो उसके नाक में एक मास दिखा. सो इन्वेस्टिगेशन ऑफ चॉइस पूछी गई थी नीट में. तो ऑप्शंस थे ए प्लेन सीटी, बी सीईसीटी पैरानेजल साइनस नोज का, और सी एमआरआई, या फिर डी एक्सरे. तो सबसे पहले हम देखेंगे कि ये क्वेश्चन हमने कहाँ पढ़ा था. तो ईएनटी ढींगरा 7th एडिशन पेज नंबर 279 में यहाँ पे कुछ क्लिनिकल फीचर्स दिए हुए हैं इनेजोफेरेंजियल फाइब्रोमा का, वो पढ़ते हैं. एज एंड सेक्स शुड बी सीन एक्सक्लूसिवली मेल्स इन द एज ग्रुप 10 to 20 years. ठीक है, रेयरली सीन ओल्डर पीपल एंड फीमेल्स. सेकेंड पॉइंट इज स्पॉन्टेनियस एपिस्टेक्सिस, रिकरेंट या फिर प्रोफ्यूज एपिस्टेक्सिस. 3, denasal speech or nasal obstruction. 4, conducting hearing loss, otitis media with effusion. Okay. 5, mass in the nasopharynx. Other clinical features are broadening of the nasal bridge, proptosis, swelling of cheek, infratemporal fossa. इसका investigation of choice जो है वो पेज नंबर 280 में दिया है. Computed tomography, that is CT by the way. CT scan of the head with contrast enhancement is now the investigation of choice. That's it. Here is your answer. If you want to know it more about it, visit that page. You're welcome. Hi, have you ever noticed
these dark spots on a child's face? Hi, welcome to the Doctor Digest.
Let's do one question related to it.
A 3-year-old child is brought to the OPD with complaints of persistent delayed developmental milestones and hyperpigmented macular lesions on the body, which are more pronounced on exposure to sunlight. What is the error in DNA multiplication? A. Base excision repair. B. Nucleotide excision repair. C. DNA mismatch repair. Or D. Homologous recombination.
Let's understand the question first.
They have given hyperpigmented macular lesions, which are discolored flat areas of skin that are usually less than 1 centimeter in diameter that get more pronounced on exposure to sunlight. That means the sunlight is the key point here. Second feature in a child is persistent delayed developmental milestones, which can be anything like speech and language difficulties, microcephaly, neurological issues like ataxia, hearing loss. This whole picture makes a diagnosis of xeroderma pigmentosa. So basically they are asking which DNA repair mechanism is defective in xeroderma pigmentosa. In Harper's Biochemistry, page number 380, they have mentioned this table in which there are DNA damaging agents which form these lesions and repair by these DNA repair pathways. The point that is highlighted in yellow are UV light and chemicals which form these bulky adducts, pyrimidine dimers, which are repaired by nucleotide excision repair. And we know sun releases ultraviolet radiation. On same page, there is this table given of types of damage to DNA in which there is single base alteration, two base alteration, chain breaks and cross linkage. UV light induced thymine, that is pyrimidine dimer, comes under 2 base alteration.
Now let's rule out options.
On the same page, they have mentioned another table in which they have shown the defective repair mechanism of DNA and their respective conditions in which they are defective. In defective non-homologous end joining repair comes severe combined immunodeficiency disease and radiation sensitive severe combined immunodeficiency disease. In defective homologous repair, there is ataxia telangiectasia-like disorder, Nijmegen breakage syndrome, Bloom syndrome, etc. In defective DNA nucleotide excision repair, there is xeroderma pigmentosum, cocaine syndrome, and trichothiodystrophy. In defective DNA base excision repair, there is MUTYH-associated polyposis, and in defective DNA mismatch repair, there is hereditary non-polyposis colorectal cancer. The point that is highlighted is xeroderma pigmentosa, which comes under the heading of defective DNA nucleotide excision repair. Take the screenshot of this page.
Save it for later. Follow for more. Hi, have you ever noticed
a child who compulsively bite the lips and the fingers? It can be due to only one enzyme deficiency. Welcome to the Doctor Digest.
Let's do one question related to it.
A patient diagnosed with intellectual disability at the age of 12. On examination, fingernail abrasions, excessive biting of lips, and increased level of serum uric acid were observed. What is the likely diagnosis? A. Hurler syndrome. B. Leishman disease. C. Hunter syndrome. Or D. Von Guerck syndrome.
Let's understand the question first.
So in this question, there is a patient of age of 12 with intellectual disability and there are 3 clinical features present: fingernail abrasions, excessive biting of the lips, and uric acid level that is high. In Harper's Biochemistry, page number 344, they have mentioned a condition in which there is overproduction of uric acid with self-mutilation. This condition is known as Lesch-Nyhan syndrome, in which there is a defect in hypoxanthine guanine phosphoribosyl transferase, HGPRT, an enzyme of purine salvage.
Now let's rule out options.
In Harper's Biochemistry, page number 611, there's a table given of mucopolysaccharidosis, in which second disease is Hunter syndrome. The enzyme that is defective is iduronate sulfatase, and the gags affected are dermatan sulfate and heparin sulfate. There is no hyperuricemia that is present in Hunter syndrome, but the clinical features includes enlarged tongue, thickened lips, broad nose, enlarged head, heart valve issues, etc. In the same table, Hurler syndrome is mentioned, in which the enzyme defective is alpha L-iduronidase and the gags affective are dermatan sulfate and heparin sulfate, which are same as in Hunter syndrome. To differentiate it with Hunter syndrome, in Hurler syndrome, cloudy eyes and low nasal bridge is present. Now what is von Gogh disease? Von Gogh disease is a glycogen storage disease in which there is a defect in glucose 6-phosphatase enzyme. In this condition, high levels of lactate, fats and uric acid in the blood. The only thing that is decreased here is glucose. There can be cognitive impairment and seizures in later stages, but there is no self-mutilation like biting the lips. So the answer here is Lesch-Nyhan syndrome. Take the screenshot of this slide. Thank you for watching. Follow for more.
Hi, have you ever noticed
these raised bumps on eyelids? Welcome to the Doctor Digest.
Let's do one question related to it.
Question number 1. A patient presented with multiple yellowish raised plaques on eyelids, xanthomas on the Achilles tendon. What is the cause for the patient's presentation? Here are your options: familial hypercholesterolemia, Tangiers disease, xanthomatosis, or Fabry's disease.
Let's understand the question first.
So in this question, there are 2 clinical features given. The first one is xanthomas on the Achilles tendon. Xanthomas are nothing but the raised bumps which are made up of lipids or cholesterol. And if they are present on the eyelids, they are known as xanthelasma. So in Harrison's Internal Medicine 20th edition, page number 2893, tendon xanthomas and congestive heart disease that is marked with yellow highlighter is under the heading of hypercholesterolemia. The first one that is mentioned here is familial hypercholesterolemia, in which there is defect in LDL receptor. And this is the different question in itself. The points with green highlighter suggestive of eruptive xanthomas, and they are the characteristic feature of hyperchylomicronemia or hypertriglyceridemia, in which the first one is lipoprotein lipase deficiency.
Now let's rule out options.
Why Tangiers disease is not an answer? Firstly, Tangiers disease is hypolipoproteinemia, in which there are low or near absence of the good cholesterol, that is HDL. And the characteristic features, or you can say the clinical feature of Tangiers disease, are the orange tonsils, in which there are buildup of cholesterols. That's why that gives it that orange color. Why Fabry's disease is not an answer? Because it is a lysosomal storage disease in which there is defect in alpha-galactosidase enzyme. The classical features are angiokeratomas and chronic kidney disease or hypertrophic obstructive cardiomyopathy. Now, xanthomatosis was the tricky one. Xanthomatosis basically is the cholesterol deposits and they can present anywhere in the body. But here in the question, specifically they have mentioned tendon xanthoma, and tendon xanthoma majorly found in familial hypercholesterolemia. So that's why the answer of this question is familial hypercholesterolemia. Take the screenshot of this slide and save it for later.
Save it for later. Follow for more.